Part 1. Why has chronic illness become so common today? And what can we do about it? Introduction. The quiet crisis of modern health. Dear friends, today, we are living in an age of extraordinary technological advancement. We can communicate instantly across continents, perform complex surgeries, explore space, and extend human lifespan beyond what previous generations could imagine. Yet, quietly and almost invisibly, a different reality is unfolding, one that threatens not only longevity, but the quality and meaning of life itself. Across the world, chronic diseases are rising at an alarming pace. Diabetes, heart disease, fatty liver, hypertension, obesity, cognitive decline, and many others. These conditions often appear gradually, silently, and years before they are diagnosed. By the time they become visible, significant metabolic damage has often already occurred. At the center of this modern health crisis lies a largely under-recognized phenomenon: repeated glucose spikes and the development of insulin resistance. Unlike infections or acute illnesses, this process does not cause immediate pain or obvious symptoms. It unfolds slowly, driven by everyday habits, frequent eating, refined carbohydrates, sedentary lifestyles, poor sleep, stress, artificial lighting, and disconnection from natural rhythms. Because this process is silent, many people assume they are healthy as long as their routine blood sugar tests remain within normal limits. However, metabolic dysfunction often begins years before these numbers cross diagnostic thresholds. This creates a dangerous gap between perceived health and actual metabolic reality. Many individuals move through life believing they are healthy, while subtle insulin resistance gradually develops beneath the surface. Over time, this state contributes to inflammation, fat accumulation in the liver and abdomen, vascular dysfunction, hormonal imbalance, and eventually chronic disease. The transition is slow, but the consequences can be profound. What makes this especially concerning is the lack of widespread awareness. Most people have not heard about glucose spikes. Many are unfamiliar with insulin resistance. Even among healthcare settings, discussions often begin only after diabetes or another disease is diagnosed. This means the most important window, the stage before disease, passes unnoticed. Prevention is most powerful during this early phase, yet it is precisely this phase that receives the least attention. This lecture is about changing that perspective. It is about understanding that health does not begin when disease appears, but long before. It is about recognizing that the best time to act is not after diagnosis, not after symptoms, but when we are still young, functional, and apparently healthy. It is about shifting from treating disease to preserving health. The modern pattern: how silent metabolic dysfunction develops. Modern lifestyles have dramatically altered how we eat, move, sleep, and live. Traditional patterns involved long gaps between meals, physical labor, exposure to sunlight, natural sleep cycles, and whole foods. Today, many people eat frequently, consume refined carbohydrates, sit for prolonged periods, stay indoors, experience artificial light late into the night, and engage in high screen time. These changes may appear small individually, but collectively, they create a metabolic environment favoring repeated glucose spikes. Each time we consume rapidly absorbed carbohydrates, blood glucose rises quickly. The body responds by releasing insulin to move glucose into cells. When this process occurs occasionally, it is well tolerated. However, when it happens repeatedly throughout the day, day after day, insulin levels remain elevated. Over time, cells begin to respond less effectively to insulin. This is insulin resistance. As insulin resistance develops, the body compensates by producing even more insulin. This stage may still show normal fasting glucose levels, creating a false sense of security. But beneath the surface, metabolic strain is increasing. Fat begins accumulating in the liver, abdominal weight increases, inflammation rises, and vascular function gradually declines. Eventually, glucose levels begin to rise, leading to prediabetes and later diabetes. But by this stage, the process has already been ongoing for years. This is why glucose spikes matter, not only because of diabetes risk, but because they represent an early disturbance in metabolic regulation. Repeated spikes trigger oxidative stress, inflammation, and hormonal imbalance. Over time, this contributes to a wide range of chronic conditions, including cardiovascular disease, fatty liver, hypertension, obesity, and even cognitive decline. Insulin resistance acts as a common upstream factor linking many of these disorders. The awareness gap. Despite the growing scientific understanding of insulin resistance, awareness among the general population remains limited. Many individuals assume that if their fasting blood sugar is normal, they are metabolically healthy. However, fasting glucose may remain normal for years while insulin resistance progresses. Post-meal spikes, elevated insulin, and metabolic inflammation often go unnoticed. Even in routine medical practice, screening for insulin resistance is not always emphasized. Healthcare systems often focus on diagnosing disease rather than identifying early dysfunction. This is understandable. Diagnostic thresholds provide clarity and treatment pathways, but it also means that the early window for prevention may be missed. This does not imply a lack of care or concern, but rather reflects how modern healthcare has historically evolved toward treating established disease. As a result, public awareness of early metabolic dysfunction remains low. Without awareness, individuals do not take preventive steps. Without preventive steps, disease eventually develops. This creates a cycle. Lack of awareness, no suspicion, no early action, disease appears, treatment begins late. Breaking this cycle requires education and personal responsibility. The importance of early action. The most powerful time to intervene is before disease develops. During early insulin resistance, lifestyle changes can significantly improve metabolic health. Diet quality, meal timing, physical activity, sleep, stress management, and circadian alignment can all restore insulin sensitivity. In many cases, these changes can prevent progression entirely. However, once chronic disease develops, the situation becomes more complex. Structural changes in blood vessels, pancreas, liver, and other organs may already be present. While improvement is still possible, reversal becomes more difficult. This is why early awareness is essential. Even more importantly, the best time to act is before any suspicion arises. When individuals are young and healthy, metabolic flexibility is highest. Building good habits early, regular movement, balanced diet, adequate sleep, exposure to sunlight, and reduced refined carbohydrate intake helps preserve insulin sensitivity for decades. This approach is known as primordial prevention, preventing risk factors before they develop. This perspective shifts healthcare from reactive to proactive. Instead of waiting for disease, we preserve health. Health span versus lifespan. Modern medicine has successfully extended lifespan. However, longevity without quality of life is not necessarily desirable. Living longer while dependent, chronically ill, or disabled may not fulfill the purpose of extended years. The more meaningful goal is health span, the years lived with vitality, independence, and mental clarity. Health span emphasizes physical independence, cognitive clarity, metabolic stability, functional mobility, emotional well-being. A person may live to 100 years, but if the final decades are dominated by chronic disease, suffering, and dependence, longevity alone has limited value. On the other hand, a slightly shorter life lived with energy, dignity, and functionality may be far more meaningful. This is why metabolic health, including insulin sensitivity, becomes central. Many chronic diseases that reduce health span share common metabolic roots. By protecting metabolic health early, we improve not only lifespan, but quality of life. Health as the highest priority. Regardless of wealth, status, or success, health remains foundational. A king, a minister, a millionaire, or a laborer. Without health, none can fully enjoy life. Wealth cannot substitute for vitality. Status cannot replace independence. Longevity without function offers little satisfaction. This realization shifts priorities. Instead of viewing health as secondary to career, wealth, or productivity, health becomes the platform that supports all other achievements. When health is preserved, opportunities expand. When health declines, options narrow. This does not mean obsessing over health, but rather recognizing it as a guiding principle. Daily choices, what we eat, how we move, how we sleep, shape long-term outcomes. Small habits repeated consistently determine whether we age with vitality or decline prematurely. Personal responsibility for health. Healthcare systems, doctors, and governments play important roles. They provide education, treatment, infrastructure, and guidance. However, they cannot make daily lifestyle decisions for individuals. Most determinants of metabolic health are shaped by personal habits. No doctor can decide what you eat daily, how much you move, when you sleep, how often you snack, how much sunlight you receive, how you manage stress. These choices occur outside clinics, in everyday life. Therefore, health ultimately depends on personal responsibility. Medical care can support and treat, but prevention depends largely on individual awareness and action. This perspective empowers individuals. Instead of waiting for diagnosis, people can take proactive steps. Instead of reacting to disease, they can preserve health. This shift transforms healthcare from passive to active. The call for awareness. Awareness is the first step toward prevention. When people understand glucose spikes, insulin resistance, and their links to chronic disease, they begin to recognize early patterns. They may notice post-meal fatigue, abdominal weight gain, cravings, or poor sleep. These signals can prompt early lifestyle adjustments. Public awareness also changes cultural norms. Instead of accepting metabolic decline as inevitable aging, individuals recognize that many chronic conditions are influenced by lifestyle. This encourages preventive habits at community and societal levels. Awareness does not replace medical care. Rather, it complements it. Individuals who understand metabolic health are more likely to seek early evaluation, follow preventive advice, and maintain long-term habits. Conclusion: the time to act is now. We stand at a turning point in modern health. Chronic diseases are rising, yet many are preventable. Insulin resistance and glucose spikes represent early metabolic disturbances that often precede disease by years. Unfortunately, awareness remains limited, and intervention often begins late. But this trajectory can change. By recognizing the importance of metabolic health, prioritizing health span over lifespan, and embracing personal responsibility, individuals can take control of their long-term well-being. The most powerful time to act is not after disease appears, but before. The ideal time is when we are still healthy. Health is not merely the absence of disease. It is vitality, independence, clarity, and the ability to live fully. Whether rich or poor, powerful or ordinary, health remains the foundation of meaningful life. Without it, longevity loses purpose. Therefore, the goal is clear. Protect health early. Preserve metabolic balance. Prevent insulin resistance. Extend health span. Live with vitality, not merely longevity. This is not only a medical message, it is a life philosophy. The time to act is now. The responsibility is ours. The reward is a life lived fully, independently, and meaningfully. Next, we will continue with part 2, focused on what can we do about it. Here we will discuss all science-backed, groundbreaking solutions in natural ways. Founder, Holistic Wellness Foundation. Imphal, healing beyond boundaries.